this conversation, it's been going on for a very long time, hasn't it? NHS problems, ambulance problems, people not getting an ambulance. But there's something about this. I mean, I've got to say, personally, I find it a bit weird that someone's come out and put a particular date on it. So specifically, August the 17th, this is when doomsday, basically, when it comes to ambulances. But notwithstanding that, what do you think what is the answer?
Well, I think I'm not going to try and explain what this guy's saying, because I'm not totally sure. He says that around August 17th, it will be the date in which a third of our resource will be lost to delays. What I think is going on there is think of a hospital like a system where you flow water through it. If the beds fill up, then the ambulances can't take the patients to the beds, so the ambulances queue up, and then people are sitting in the ambulances and so on. And that's what I think he's saying here. And I have a very close friend, actually, who worked for an ambulance service and experienced that a lot, where ambulances would queue back and we get this horrendous situation where people were not getting the care that they needed, right? I think we've got the immediate thing of the shock that COVID caused to the NHS as a system, how that led to huge spikes and people having been in hospital. It basically caused a massive amount of demand that the system couldn't take. We've got a longer-term problem of there having been underinvestment in certain areas. Beds is an example. The number of beds was going down at the point where COVID came, and we really needed those beds. There's not been enough investment in nursing. There was a massive shortfall in nurses before COVID came along. We're not getting enough investment in GPs. We've got a low number of GPs across the country, which means that they're not able to properly triage, to properly sort of sort people at the beginning of the flow before they're then resorting to have to use ambulances. And then
about beds, by the way, in COVID, I remember there's what they're called Nightingale things, hospitals that were set up with tons of beds, pretty much empty the whole time.
But this goes to the starting problem, right? Like, in some ways, the Nightingale thing was just for show, to kind of boost the morale of the country, I would say. Because what do you...
Really? You're telling me that they sat there and thought, you know what, I'm going to boost the morale of the country by building a hospital and keeping it empty?
I think that was an unintended consequence. I think it was a case of saying, you know, the Chinese government, China can respond in this way, Britain can also respond in a certain way. You got a bed, right? You need three things to help people in hospital, right? Roughly. Bed, the kit, ventilator or whatever, and the people. Very easy to get beds going. Kind of easy in some ways to get the ventilators going. Very hard to get the right people, particularly in the context of COVID. You have to have very specialised training to be a respiratory nurse, and you ideally need one-on-one care, one patient, one nurse, right? So in some ways, the Nightingale's there to be like, whoa, the beds bit, amazing. But the problem is that we reached COVID with a shortfall of something like 40,000 nurses at a moment where we really needed those nurses. So the NHS is suffering from that underinvestment. And then, of course, longer-term problems like so-called non-communicative diseases, obesity, other lifestyle problems that we know are saturating the NHS. So this is a hugely complex thing that cannot, of course, be dealt with just some more funding. But in the case that we're seeing here, if this ambulance provider, who we should, rely on to be talking about how severe the situation is, they need some immediate help to deal with some of that backlog, and that the people here will be overworking. It's an exhausting, very tough situation to be in. We should be very thankful to those who are on that front line, and they do need some immediate support to help ease that pressure. But we need to deal with that chronic underinvestment.
Someone just emailed in while you're talking saying, "Oi, Michelle, tell me the name of this gorgeous man sitting to your right again who's talking. Get him back more often." That is Laurie Laybourne. There you go, we'll make him blush. And while he's recovering from that, Chris, where do you stand on this? Because often the answer comes back from people, doesn't it? More money, more investment, more money. What do you think? Is it the case of more money, more complex,
so
or
much
what?
Money now, it's getting ridiculous. £230 billion of the NHS budget last year, plus another 40-50 billion pounds on private healthcare. If you look at it as a percentage of GDP, we're spending more than nearly any other country in the world now on healthcare. You cannot blame this on underfunding. It has been a deliberate decision, not just in the UK, but in the UK, in the last 35 years, we've halved the number of hospital beds, despite the population rising significantly, because a lot of very clever people who work in the health service decide, actually, we don't need beds, something as old-fashioned as beds, and we don't need people getting better. They can go home and get better. And you're quite right. Obviously, what you need in hospital, primarily, doctors and beds and equipment. And we've got about a third fewer doctors than comparable countries. You compare it to the OECD, Club of Rich Countries, about a third fewer doctors, half as many beds as we used to have, and far fewer beds than OECD countries. It's an absolute scandal. And I just wonder, where is this money being spent? Where's it going? We haven't got the doctors, we haven't got the beds, therefore we have massive waiting lists, 1 in 9 people now on a waiting list. You've got this problem with the ambulances, and people in the NHS will say, well, it's bed blockers. The real problem is people in bed not needing to be there. There is an issue with that, but what you could also do is have more beds. And then you could tolerate having 10% of your patients being bed blockers.
But it's not the NHS's job. If someone's fit and well enough to go home...
They've got nowhere to go. It's a social care problem.
Yeah, exactly. But it's not the NHS's responsibility then to be almost like a daycare service for people, healthy, well people that have got nowhere else to go.
No, of course, it's not in an ideal world. But the fact is they haven't got anywhere else to go. Yeah, maybe we should be spending a bit more on social care. We're now being taxed for it, after all. But the bottom line is, and it's not just with this issue, it's with so many issues across the NHS, there are far too many chiefs, not enough Indians, and there's not enough hospital beds.
Joanna?
Yeah, I agree. This is not just an issue of money. I mean, the NHS has got such huge problems, and yet for years, really, we've not discussed these problems. We went out and banged our saucepan lids and clapped for the NHS and kind of worshipped it without really getting to grips with what the problems are. Criticising the NHS was kind of a taboo that you weren't allowed to do. I actually think the specific problem in this case is the shortage of beds, but that's hugely contributed by well people who could be discharged, taking up beds in hospitals. And I think we do really need to look more closely at why people aren't being discharged. And I mean, I agree with Christopher, one easy solution would be just to make more beds, you know, and have everybody who's got nowhere to go taking up a hospital bed. But actually, you know, people don't really want to be in hospital. I'm sure a lot of these well people want to be moving out, want to be getting on with their lives. So we need to look at why can't people move into care homes, for example? Was it a mistake to have the vaccine mandate for care home staff? How many care home staff were lost to the profession at that point because they didn't want to have a COVID vaccine? Is that something that's worth revisiting? What about the pay for people who work in care homes? I'm sure for a lot of people who work in care homes, if they think they'd be paid more by working in a coffee shop or working checkout in a supermarket, they're going to look at what's expected of them in a care home compared to what would be expected of them working in a supermarket and think, actually, I could earn more and have an easier job elsewhere. So perhaps we do need to look at paying people who work in care homes more, making it more incentives to create more care homes. I mean, you go back far enough in history and there were actually kind of special convalescent hospitals. Where I live in Kent, you see on the coast, these kind of huge buildings that were once special places for people to go and convalesce. Perhaps it's worth bringing back something like that so you've got a halfway house between a kind of hospital and being released. But the point is, you know, as Christopher's saying, you've got so much money going into the kind of bureaucracy that we're not able to take the step back and actually look at providing these kind of solutions.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.